Hi, I'm Dr. YVRao, plastic surgeon from Dr.YVRao Clinics, Hyderabad and Vizag. Today I'd like to share a case of hair transplantation in special circumstances. Hair transplantation is a routine for us, but what I felt is the situation behind that is the background is not normal. So it's a little different. So I thought of sharing with you these points. So he's 28-year-old, and then when he was 10 years younger, that is at the age of 18, he was hit by a lorry and then he sustained head injury at Vijayawada, for which he was operated 3 times by a neurosurgeon and his team. And first because of the clot and for another reason some problem, and then later on by tracheostomy and other procedures also. So what he felt is ultimately he ended up, apart from the baldness that he has inherited from his father or parents, he had multiple unsightly and ugly scars all over the forehead and the front part of the scalp. So normally when neurosurgeons operate, what they do is they throw, especially for severe cases where they want to drain the blood, they use a bicoronal approach from ear to ear across the scalp. It's like this in a zigzag way. So some different people use different types of cuts. Some use a straight cut like this, some use like a Z also. So it all depends on the type of the neurosurgeon that is operating. So in this case, apart from that scars, there are significant cross hatches. Cross hatches means if this is the scar, cross hatches are across perpendicular to this one. That is when we take the bite suture material, on either side we hold the suture like this. The suture makes the mark. So ultimately in plastic surgery, what we always teach is, it is the amount of the suture that is on the skin which gives the scar. So if the suture material on the skin is the least, it gives the least scar. In fact, if nothing is there, it gives excellent scar. So, and then the other one is tension. So these two should be avoided in anything, but unfortunately for various reasons during the emergency, they might have operated with threads or clips. In fact, clips produce significant, especially when they are kept for longer periods, they produce significant cross hatches, which are very difficult to eradicate. So what I try to do is include the hairline design. So I included in such a way it covers most of his scars. In fact, instead of concentrating on his baldness, in this first session, what I try to concentrate is, I try to cover the front part of the baldness only, and then try to cover most of the scars which are from, and then even extending up to these regions also, and even backwards also. So scars, as you all know, scar is like almost like inside it's a desert. How the plants do not grow well in a bad soil, for example, like a desert, whereas they grow well in a good soil. So likewise, the grafts that we place in a scar, they don't take much. Suppose I place 10 grafts, not all grafts will survive. Maybe half of them they may survive, and half they may not survive. So we may need multiple sessions, maybe 2 times we can give to increase the density. So this is the situation. So I try to cover all the scars and the front part of the baldness. Afterwards, I think we'll see how the results will be approximately. I think we have achieved a reasonably good density with a reasonable coverage of the front part of the baldness and the scars also. In this case, which I was mentioning, and then some of the pictures you can even see also. And this is so for these few background problems or with these special problems. So I thought of sharing with you this type of a special case, and especially when you're operating in a special case like this. In fact, to tell the background, the patient's attenders approached quite a few doctors who do the hair transplant surgery, and they got the confidence in me and being a plastic surgeon. And then I was referred by somebody at Vijayawada, for which I was quite fortunate. And being plastic surgeons, we complete general surgery course also. During the general surgery course, we see all these neurosurgical operations, heart surgeries, urology surgery, so many of these things. So we know the background problems also, how they deal with, what are the cuts that they do, to what extent the cuts are, and whether they place. Sometimes in this case, actually, the bone is missing at quite a few places, a significant amount of bone. So I had to take care of those bones also, because If I go deeper, even by about a millimeter or so, I may hit the layers of the brain, which is catastrophic. So we should be, so that's where experience counts and the degrees also count. So being a plastic surgeon, we know, because we work with neurosurgeons and then we work with cardiothoracic surgeons, we all know this. And despite this, sometimes we may commit mistakes, but at the same time, we know what precautions that we are supposed to take. So we do it, and then we have done extensively, and then we have done very well for these procedures with a reasonably good coverage of the area.